Well, science isn't simply helping us discover new medicines for coronavirus. Fox Medical contributor Marc Siegel joins us to describe some other promising advances in the last few days, and thank heaven there have been some. Doctor, thanks for coming on.
Tucker, we have some good news to report today, which we badly need. First of all, researchers out of Johns Hopkins have been looking at this virus very steadily, geneticists, and they've determined that so far it's stable. Now, you know what that means? It means that the vaccines that are in the works here are likely to work and cover it even if they come out a year from now. It's very good news that the vaccines look very promising. I've talked to Dr. Tony Fauci about it. He agrees, very promising candidates that will work, vaccine to a virus that is not changing. Second piece of good news is that we're finally getting the rapid tests, antibody tests that I've been talking about, where you take a single drop of blood and you find antibodies to the virus that tell you if you've been exposed in the past and whether you have an active infection going on. Labs all over the country are looking into this, and in the United Kingdom, they're releasing a test that literally will give you results within 15 minutes. So we can tell who's infected and who isn't infected. Third piece of good news is that in New York State, they're actually starting to take plasma from patients who are recovered and using that plasma, putting it into very sick patients that will possibly keep them from very poor outcomes, including death. That too is an extremely positive thing. And fourthly, and unexpectedly, Tucker, it looks like the rate of hospitalizations in New York, though still on the upswing, the rate itself is starting to flatten out a little bit. That means we may not need the 30,000 respirators, which I can't even put my mind around, because that would mean 1 or 2 million people get coronavirus, God forbid, in New York, which would lead to about 2% of them requiring respirators, ventilators. We're not heading in that direction. It's starting to slow. My prediction is we're going to need much less ventilators and more protective equipment going forward. Tucker.
Man, I hope you're right. That would be the best possible news. Dr. Siegel, thank you so much for that update.